Well, I think the testing at the beginning was at the right level. I mean, I think at the beginning, Public Health England got off to a good start in terms of testing to try and make sure that they caught people coming into the country with it. I then think it's not scaled as fast as it needs to scale, and that's being done now. But I do think testing is an incredibly important bit of this. It needs to be done at scale, and it needs to be done rapidly enough to be able to look at outbreaks and isolate. And I think it's been good in terms of what's been able to be done in hospitals. It clearly hasn't been at the scale that's enabled all the healthcare working testing that's an important part of this. And I think that's why it's so important it does get into the right position now. I think there are two bits to that. I mean, they have done more testing than us, and I think that is something we absolutely need to get right. There's no question, in my view, testing is an incredibly important part of how we need to manage this going forward. It was something that we raised right at the beginning as something that needed to be in place, and we need to get more testing. That's happening at the moment. I don't think that you should equate the testing, though, and the outcome in Germany. There are all sorts of reasons. I mean, there may be a relationship between the two, but there are all sorts of reasons why rates may be different in different countries. And I don't think testing alone is the major reason for that. And so we need to understand why outcomes are so different in some different countries. That may have to do with things like the concentration of people in cities. It may have to do with things to do with demographics, age structures of populations. It may have to do with other things on top of that. So yes, testing, there's a lot that we've got to get right on that. And is being looked at now by Public Health England and Department of Health, and they are getting that right. But I don't think it's as simple as to say lots of testing saves lives, because that isn't quite right, I think.